Anxiety can be crippling. Add anxiety to any medical diagnosis, and the treatment just gets more challenging. Having insurance that few accept creates anxiety. Being offered an unaffordable plan with no other choices creates anxiety. Having deductibles so high you can't afford care creates anxiety. As a doctor and a caregiver, I've seen this firsthand. And that's why the Affordable Care Act has been such a huge concern of mine. While some Americans have been helped under the Affordable Care Act, far too many families have been kept up at night, worrying about whether they have coverage and how they're going to pay for it. Already 1/3 of the counties in the country have only one company offering insurance, and some Americans have no plan to choose from at all. Yet, they're legally bound to pay a penalty if they don't choose a plan. In the land of the free, I'm bothered that Americans are forced to buy something or be penalized just because they're alive. And that's what we have here. As a doctor, I will fight on behalf of my patients. And I could not, in good conscience, vote to keep a government mandate in place that takes away their choices, forces their compliance, and fails to give them access to affordable care. Especially when the American people, and a clear majority of my constituents, voted overwhelmingly for repealing and replacing the Affordable Care Act just in November. At the same time, I greatly appreciate everyone who's called, emailed, or spoken to me directly to share your thoughts and feedback. That's what it takes. This is clearly one of the most passionate issues in America for folks opposing and supporting the Affordable Care Act. After weeks of negotiations of the American Health Care Act, many voices have been heard and some important adjustments have been made to the bill. Now it's time to get rolling, and here's why. This bill is just the beginning. It's not law yet. It has to go to the Senate, then back to the House, and then together to the President. But it is a significant step towards giving Americans their freedom back, starting the extremely challenging process of unwinding Obamacare and creating a more patient-centered system that will make health insurance, and most importantly, access to care, not just a piece of paper, but make it more affordable for all Americans with access. Now, every American has a different situation, and we need to provide for the most vulnerable. I've heard the most concerns from folks about Medicaid and pre-existing conditions. I believe Medicaid is an important and valuable tool and greatly needed safety net. I also believe we can do better. The goal of the reforms in this bill are to give states flexibility to better address the unique needs of their citizens with the opportunity to increase access to real care in our healthcare system. It will also encourage more efficient spending in the Medicaid program. On pre-existing conditions, I've said long ago that I want to ensure Americans can't be denied coverage on the basis of pre-existing conditions. The accusation that this bill does not address this issue is false, and I've spent hours working with my colleagues on a reasonable and effective method to provide for pre-existing conditions for patients. What this bill does is it gives states more control over local insurance markets. And the goal is to empower states with the ability to design insurance frameworks that fit the needs of their citizens, providing quality care and lowering costs, but only while maintaining layers of protections for patients with pre-existing conditions. This bill won't please everyone on all fronts, not even me. For example, there's currently an exemption for members of Congress. I don't support that, and I never have. Although the President, Supreme Court, and administration and secretaries and their staff were always exempt from the Affordable Care Act, Republicans in Congress made sure that members of Congress were not exempt from the Affordable Care Act, and Republicans will do the same with this bill. Washington should live with the same rules as the rest of America, period. So here's the bottom line to me. This bill gets us on first base. And now we'll need to go through the Senate, to the President, and there's still much work to be done to fix our healthcare system that can't be done just through this tool of reconciliation. But it's time to fulfill our promise to the American people, who again voted overwhelmingly to repeal the Affordable Care Act and focus on affordable, patient-centered, free market-based care. As a doctor, I want to do everything I can to see all Americans have health insurance that they can afford and that actually allows access to the best providers available. May we, with God's help, mend our every flaw. I'm Brad Wenstrup. Thanks for visiting the office.